patient considered for the hematological examinations. Which patients should we consider to do for the blood test? Okay, number one, it is recurrent epistomatitis. When patient has sore or dry mouth, atypical history or unusually resistant to treatment. When the patient you have prescribed some medications and the patient is showing resistance to that medication, there is a sore or burning mouth or tongue or abnormal taste, means the patient has a continuously burning mouth and there is an alternation in taste sensation, even no mucosa changes, you means there is no change in the oral cavity, but still you have burning sensation and you have abnormal taste. When you have persistent oral and orofacial candidiasis. So number one, when you have ulcer, dry mouth, show resistance to treatment. When you have burning or alternation of taste. When you have candidiasis, patient showing abnormalities following initial screening, and patient showing also abnormalities following in initial screening when. Okay, so in this type of patient means when the patient has ulcer or dry mouth, or when the patient has candidiasis, show resistance to the treatment, when the patient has also alteration and burning mouth, okay, and also showing the abnormalities following in an initial screening. Now number one very important a disease is scurvy, which is very important. It is due to a deficiency of vitamin C, means basically there is so when there's a decrease vitamin C, so there's a reduction in the collagen synthesis and capillary fragility with the hemorrhage and the poor wound healing due to the uh, okay, so you have to understand when there's a decrease or deficiency of vitamin C, the patient does not have collagen production and the capillary fragility, the capillary is more fragile with the hemorrhage, and poor means there is hemorrhage actually because there is no collagen. Okay, so hemorrhage is there and poor wound healing due to the vessels weakening. The blood vessels are weak, no collagen, no elasticity, so the wound healing is also slow on the same side. Now, what is the cause? It is basically poor diet. The clinical features is it will affect the gingiva or and oral mucosa, generalized gingival swelling and redness, spontaneous gingival hemorrhage, ulceration with mobility, and periodontal bone loss. Means the patient will have the periodontitis and gingival hemorrhages, oral mucosa petechiae, hemorrhages, enchiosis, and delayed wound healing. When there is a delay, so means it is a scurvy. Enamel hypoplasia of teeth on the same side, means the patient suffers from the generalized gingival bleeding. It is effect basically ulceration and mobility, and also bone destruction or bone loss. It is petechial hemorrhages, enchyomosis, and delayed wound healing, and enamel hypoplasia of teeth. Others are follicular hyperkeratosis, skin hemorrhages, and enchymosis, conjunctival hemorrhages, melena, hematuria, and some periosteal hemorrhages. Tenderness of lower limb, inability to walk. Okay, then moderate to severe anemia. Moderate to severe anemia patient has subarachnoid and intracerebral hemorrhages, subarachnoid and intracerebral hemorrhages, weakness and fatigue. Because there's a loss basically. Now there's a deficiency, so fatigue, weight loss, and there's an lassitude. Okay, how you diagnose it is basically you check the ascorbic acid levels, which is below the zero point 0.1 milligram per dc through the bite wing radiograph to determine the periodontal bone level. You also see the ascorbic acid level, which is less than zero point 0.1. You also do a bite wing radiograph to determine that periodontal bone level is which actually. Basically, bite wing X-ray is this of the when there is an opposite when you have two opposite teeth upper and two opposite teeth down. So you just basically assess the bone level actually, not more than. Then you have necrotizing ulcerative gingivitis, nang. Periherpatic gingivitis. It is again related to gingiva. Thrombocytopenia purpura is related to enchymosis, bruises, petechiae, aplastic anemia, and leukemia. The treatment is improve your oral hygiene. Number one, you should have those fruits and vegetables who are rich in vitamin C, ascorbic acid, 1 to 2 grams per day. Okay, topical mouth washes and plaque control program should be followed. Means there's also a bad oral hygiene due to, because you have to correct the gingival bleeding, oral ulcerations, tooth mobility, bone destruction is there severe. Okay. Oh. So another we have actually is the increased level of the sex hormones. Number one, when patient is during pregnancy. Okay, so when a girl is actually pregnant, so she has actually hyperplastic gingivitis or diffuse gingival inflammation, because you have increased levels of estrogens and progesterone, so it affects actually. So hyperplastic gingivitis, and you have diffused gingival inflammation, you actually. Then there's a minimal proliferation of the fibroblast actually. Okay, then marked proliferation of capillaries lead to a purple color of the of the gingival papilla. The purple color is shown in the gingival papilla when there is a proliferation of the capillaries. Basically, the papilla are tend to be fragile and bleed on minor injury. In this case, the papilla are very fragile and weak actually, so they can bleed very easily actually. And the false pocketing bleeding means you have a false pocketing bleeding. Stagnation of the secondary infection leads to halitosis. So number one, patient has the gingivitis, hyperplastic gingivitis actually. Number two, it has actually purple color of the gingiva. Okay, then there is papilla bleed very easily, then false pocketing bleeding, then you have halitosis, and the apellus can also occur. Apellus can also, which is actually exuberant growth of granulation tissue in the interdental papilla actually. Clinical diagnosis should be made, but do not do biopsy, because this condition regress or recover after the when after the pregnancy. Okay, treatment, good oral hygiene. Okay, to lead to complete resolution of a discrete apellus like mass. Menopause, no evidence that has hormonal changes occurring basically during after the menopause directly affects. Means there is no changes in the oral cavity during when woman passes their menopause. Okay, so basically you have studied in the pregnancy, you have a plastic gingivitis, you have gingival bleeding actually. Okay, you have halitosis, then you have also interdental papillar apellus is also present in that area. Then you have also studied about the purple coloration of the papilla. Papilla are so fragile that they bleed very easily.